Next presenter is my colleague, Dr. John Sweeney, who is an excellent interventional cardiologist, director of the Structural Heart Disease Program and co-director of the Valvular Heart Disease Clinic. He is going to talk about transcatheter aortic valve implantation update, appropriate patients, and new technology. Jack?
Thanks, Harry. Thanks very much. Boy, it's a big crowd today here. It's really kind of impressive that you guys have gotten the meeting together so nicely. Every year I talk about TAVR in some respect at this meeting, and I have to tell you, TAVR is probably the one thing I just absolutely still love talking about, because I think it's one of the algorithm-changing technologies that's hit cardiology in the last 25, 30 years. I mean, it is really undoubtedly and unquestionably a technology that the surgeons and the cardiologists agree is beneficial to certain patients with aortic stenosis. And it's really a game changer and a huge improvement for patients that we take care of on a daily basis. It's really an impressive technology, and we'll talk a little bit about some of the technology, the indications and such as we move along here. The indication for TAVR, of course, is severe native valve aortic stenosis, and we'll talk a little bit about bioprosthetic stenosis as well, which is an indication for TAVR. We'll talk about that in a few minutes, but let's talk about native aortic valve stenosis. The criteria for this are just as Vui went over, which is based on our guidelines, and you have to have symptoms compatible with severe aortic stenosis, and that would be dyspnea on most patients. Some have presyncope or syncope, much less common. Exertional chest pain, a little bit more common. Vast majority of patients have dyspnea when they present with aortic stenosis. If they don't have symptoms, we'll talk about how we exercise them and see if they have abnormal hemodynamics on exercise testing. Exercise testing is a really important part of your evaluation of patients with severe aortic stenosis, and you have to find a cardiologist who's willing to do that. Not all cardiologists feel super comfortable exercising somebody with severe aortic stenosis, but it's shown to be quite safe in asymptomatic patients and is a reasonable part of their evaluation. The hemodynamic evaluation to determine they do have severe aortic stenosis is, just as Vui said, based on echocardiographic criteria. The details, the devil's in the details in these evaluations, and he just went through all that, but that stuff is unbelievably important in how we take care of these patients. So you have to have a really competent and very thorough echocardiographic laboratory to really properly assess these patients. It's a critical part of the evaluation. This slide, I think, is something you should take home with you, because this kind of summarizes exactly what we do every day in TAVR clinic, and it's sort of the flow chart of when somebody comes in with aortic stenosis. On the left, you see severe high gradient AS. That's the typical one. Gradients over 40, the velocity is over 4, valve area is under 1. Are they symptomatic? If yes, they qualify for some valve intervention. If not, we exercise.